However, the flu and COVID vaccines aren't the only inoculations medical professionals are worried about. Chelsea Edwards is live in Beverly Hills with that story. Chelsea?
Christine, we're talking meningitis, the measles, whooping cough. Since the pandemic began, we've learned that those vaccination rates among children have dropped, plunged, not just here in California, but across the country for a variety of reasons that parents are citing. They're either canceling or postponing some of their kids' health care appointments. And health officials saying that it is so important now for both the public safety and public health to get these kids vaccinated.
You put your child in the car, you put your child in the car, and you buckle them in right away. You don't wait to be driving and then buckle your child in. Just like the same way with vaccinations, you don't wait for an outbreak of that particular disease to get the vaccination. It takes time for the vaccinations to work. I fear that there's going to be a breakout of other preventable diseases. Such as like measles and chickenpox.
So scary to think about. You just heard from Dr. Rishma. She's a pediatric ICU physician at Dignity Health Northridge Hospital. She says she's worried that kids are going to be behind on their vaccines when restrictions start getting lifted even more and more kids start going back to classrooms, potentially causing a second non-COVID health crisis. Now, the California Department of Public Health found that vaccines for children decreased by more than 40% in April compared to the same month the previous year. Also, a recent CDC study found that the number of vaccine doses that were ordered by doctors in the U.S. started to decline the week after the COVID-19 national emergency was declared in mid-March. And something to note, even though our kids in our state are likely going to start the school year online, vaccination laws still require the kids to be up to date on their shots before starting class, again, even if those are just online. Now, there are a variety of reasons that parents are choosing not to vaccinate their kids in the midst of this pandemic. Some say that they're concerned about sending their kids to an overcrowded wait room at a pediatrician's office. Others who may have lost their jobs or health insurance concerned and maybe they may not know about the assistance that is being offered to kids in those situations who may not have health insurance. We talked to several parents today who say that they understand the concerns that are out there, but feel that it is so important and critical to get kids vaccinated. Listen here.
I think the doctors are taking proper precautions. They're not having too many people in the waiting room. All the siblings can't come just to, wait for one sibling to get vaccinated. So I think that the doctors are doing what they can.
There's a reason why these were invented, and we need to stay on top of it to keep the health of our country and the future generations intact.
Yeah, and something to think about that health officials are saying kids who may not have been vaccinated for things like the chickenpox or the measles are more likely to end up in either ER or hospital situations where they could have even greater exposure to COVID-19. So really the bottom line from health officials today, it is just as important now as ever to get those kids up to date on their shots. Live in Beverly Hills, Chelsea Edwards, Fox 11 News.
Good discussion there, Chelsea. Thank you.